Hello, I'm Dr. James Bogash, expert in health and longevity and creator of Bogash Life and Balance. And today we're going to talk about a topic I have frequently in my chiropractic office, and that is the subject of anti-inflammatories. We live in a society that just thinks that it's okay to take anti-inflammatories if we have the slightest ache or pain, or, ooh, this one always grates me, people take it just in case they may be sore. So let's say you're going to be going to work out in the gym or hike or something, and you take anti-inflammatory like some ibuprofen before you go just so you won't be sore. But the reality is, like, that's part of life. That soreness is just that sign that you actually created some muscle damage and your body's going to rebuild stronger. But those anti-inflammatories we have known for a long time that they actually damage the very joints we think we are protecting. We know that the anti-inflammatories have a tendency to inhibit chondrocyte function, and the chondrocytes are the cells lining our joints, so that if you stop them from living a healthy life, if you stop the cells lining our joints from being healthy, there's going to be a price to be paid. And so I remember reading an article, probably 20 years ago now, that showed a direct relationship between anti-inflammatory use and joint replacement. So, which is what people are trying to avoid by taking anti-inflammatories. But you have to understand that inflammation is a normal process, and I consider it like a hill. And we obviously, in the initial injury, we want to keep that hill small. Ice is probably a much better option for that. When I dislocated my thumb, dislocated my elbow, I iced them down. I don't take any anti-inflammatories. Personally, I haven't taken anything like that in over, probably 30 years, despite some decent injuries that weren't a lot of fun. Never even crosses my mind to take an anti-inflammatory to manage pain. So it's a hill. We want to keep that hill smaller, and that's where things like ice can play a role. Well, anti-inflammatories, you could argue, maybe make that hill smaller. But ultimately, once the acute inflammatory stage is passed, that can be as early as 12 to 24 hours, we want to get over that hill. And I strongly believe that anti-inflammatories keep us stuck on this side of the hill or mountain, kind of like the mythological creature. Was, I can't remember the character's name, but was forever doomed to push that hill up, push a rock up a hill or a boulder, and it kept falling back down. That's what I consider that anti-inflammatories do. And what I've seen over the years is when patients take them religiously, nothing ever really resolves. They just start to catalog. So they start with neck pain, and then that never really goes away, and then they develop back pain or knee pain or wrist pain. And over the years, they accumulate this catalog of musculoskeletal complaints that never really resolve. So just to back this up, there's this recent study looking at joint space loss over the course of 8 years in a little over 2,000 subjects. They were I believe they were 65 and older, 55 and older. I'll put it in the description. But they followed them for 8 years, and they found that those people taking anti-inflammatories had greater joint loss, joint space loss. In other words, the people taking anti-inflammatories did worse over the course of 8 years than the people who didn't take anti-inflammatories, which supports the concept that they're not good for us, even though every commercial, every recommendation, every doctor out there, not every, but most doctors out there tell you to take ibuprofen or give you a prescription for meloxicam or something along those lines, or diclofenac. But ultimately, those are probably damaging our joints and soft tissues much more than they are helping. As always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.